Hello and welcome to Carpe Diem. Today I will be discussing with you the categories of seizures. There are quite a few, so I'll jump right in. You get idiopathic epilepsy, symptomatic epilepsy, and the following types of seizures. Partial seizures, which are broken down into simple partial or complex partial seizures. Then you get generalized seizures, which are absent seizures, tonic-clonic seizures, or myoclonic seizures. Let's talk a little more about idiopathic epilepsy. Idiopathic epilepsy is believed to have a strong underlying genetic basis. People with idiopathic epilepsy are typically otherwise normal and have no structural brain abnormalities. Patients also have a family history of epilepsy and seem to have a genetic predisposition to risk of the seizures. Idiopathic epilepsy tends to show itself between early childhood or adolescence, although it can be eventually diagnosed later. The genetic cause of types of idiopathic epilepsy is known, though inheritance is not always a simple mechanism. Symptomatic epilepsy is a little more simple, although not necessarily easy to treat. It refers to epilepsy that is a symptom of an underlying problem, such as a brain injury, an infection, a brain malformation, a tumor, or a metabolic disorder. Moving on to partial seizures. A simple partial seizure. People who suffer from these seizures are usually fully awake, alert, and able to interact throughout the seizure. Overall, these seizures are brief and last less than 2 minutes. Complex partial seizures. These seizures usually start in a small area of the temporal lobe or frontal lobe of the brain. They quickly involve other areas of the brain that affect alertness and awareness. So even though the person's eyes are open and they may make movements that seem to have a purpose, in reality, nobody's home. If the movements are subtle, other people may think the person is just daydreaming. Often, people may have a seizure without even realizing they've had the seizure. The seizure can wipe out memories of events just before and just after it. Partial seizures, both simple and complex, are controlled by the function of the brain area in which they occur. Absent seizures. Absent seizures are lapses of awareness, sometimes with staring. They begin and end abruptly, lasting only a few seconds. Because absent seizures are so brief, they can sometimes be only diagnosed after a long period of time. Tonic-Clonic Seizures. This is the type of seizure that most people think of when they hear the word seizure. An old term for them is grand mal seizure, and as implied by the name, they are combined by the characteristics of tonic seizures and clonic seizures. The tonic phase comes first. All the muscles stiffen, air being forced past the vocal cords, often causing a cry or groan. The person loses consciousness and falls to the floor. The tongue or cheek may be bitten, so bloody saliva may come from the mouth. The person may turn a bit blue in the face. After the tonic phase comes the clonic phase. The arms and usually the legs begin to jerk rapidly and rhythmically, bending and relaxing at the elbows, hips, and knees. After a few minutes, the jerking slows and stops. Bladder or bowel control sometimes is lost as the body relaxes. Consciousness returns slowly, and the person may be drowsy, confused, agitated, or depressed. These seizures generally last 1 to 3 minutes. A tonic-clonic seizure that lasts longer than 5 minutes needs immediate medical help. A seizure that lasts longer than 10 minutes, or 3 seizures without a normal period in between, indicates a dangerous condition called convulsive status epilepticus. This requires emergency treatment. Myoclonic seizures are brief, shock-like jerks of a muscle or group of muscles that occur in a variety of epilepsy syndromes that have different characteristics. During a myoclonic seizure, the person is usually awake and able to think clearly. I hope you have found this session to be informative, and once again, the slide that I have made will be available on my Google Plus page for you to use for further information and to educate others. Please stay tuned for tomorrow's episode.